Gastrointestinal disorders can cause a lot of discomfort for patients who want to live their everyday life normally. Psychologist Sarah Kinsinger from Loyola Medicine is here this morning to talk a little more about treating your GI disorder, but not in the typical way that you would expect. Thanks for joining us this morning.
Thank you for having me.
Okay, so when we talk about GI disorders, let's start with the list of different disorders that you deal with. What are they?
Sure. So the patients I see most often are patients with inflammatory bowel disease. So this is an autoimmune disorder that causes inflammation in the intestines. And then I also see a lot of patients with irritable bowel syndrome. This is one of the most common disorders affecting 1 in 7 Americans. And psychological treatments are actually really effective for treating those patients.
Which I find interesting, and that's why we have her on this morning, because these are extremely common conditions that people often go to see a doctor about and often go and get put on medication. But you're saying in some cases you don't need to. Explain how this works.
Yeah, sure. So especially conditions like irritable bowel syndrome, we believe a component of what's contributing to these symptoms of uncomfortable abdominal pain, diarrhea, constipation is a breakdown in our brain-gut connection, so this pathway between the brain and the gut. And medications can't always address that component, yet psychological treatments can.
Really? And how so? Because my first reaction is, are you telling me this is all in my head?
Right. Great question.
Because I think some people, that's frustrating for them.
It is. They often feel dismissed, and it had in the past been referred to as more of an emotional disorder, which we do not believe.
Which is extremely insulting and not good for the patient to hear.
Absolutely.
Okay, so in this case then, can you explain this brain-gut axis and how this works?
Yes, so our gut has its own nervous system. It has over 100 million nerve endings, and it's constantly communicating with our central nervous system. And so moment to moment, there's this communication pathway between the two. And in some disorders, we think there's sort of a breakdown in that communication, causing the nerve endings of the gut to be overly sensitive so that even normal muscle movements may feel highly painful. And then the brain can sometimes misinterpret those signals.
Interesting.
So what psychological conditions, psychological treatments can do is we can actually influence how the brain is communicating with the gut and have some control over digestive symptoms.
Okay, I find this fascinating. Now, you are one of few people in the country that even do this. What's your official title for this?
Right, so I call myself a GI psychologist. Okay. There aren't many of us around. I exclusively treat patients with gastrointestinal disorders. And we have some really good science behind these treatments. Over 30 years of research showing that treatments like gut-directed hypnotherapy, cognitive behavioral therapy actually improve symptoms for patients with conditions like irritable bowel syndrome.
Wow. So give me an example. What are some of the things or exercises or techniques that you tell your patients to use? What are they?
Sure. So things like thought restructuring, so reducing negative thinking and worry related to the symptoms, and strategies to control physiological arousal or stress in the body.
So, for instance, say I have irritable bowel syndrome. When you say, restructuring or how you think, what would you tell me? Give me some advice.
So it can be very embarrassing and uncomfortable to deal with these symptoms, especially in social settings. And so what can happen is patients develop stress and reaction to the symptoms. So they start focusing too much on how their stomach's feeling before, let's say, a work meeting. They start worrying, uh-oh, I'm going to have problems. My stomach's going to get upset. I'm going to have to rush to the bathroom before they've even had symptoms. And so we talk about strategies to reduce those worried thoughts and to help them to stay in a more relaxed state so that that is not aggravating their symptoms.
So that's so interesting. I can totally see that then. So they're so worried about it that they almost aggravate the situation even worse.
Right. It becomes a vicious cycle.
Right. So, okay, so what's your best advice for anybody who is struggling with any GI disorders and is currently on medication and it's not necessarily doing the job, because that's obviously where you come in. What's your best advice for them?
Yes, so definitely talk to your providers about this. There's a lot of patients with IBS that are embarrassed to talk about this, that aren't getting adequate treatment, and don't be afraid to bring up the role of stress and anxiety. I think often patients are uncomfortable with that, but it is an important piece of the picture, and there's effective treatments and strategies we can help patients learn.
Okay, and the best website for people to find out more about you is where?
On Loyola Medicine.
Okay, thanks so much for joining us this morning. I think this is such helpful information. We appreciate you coming in.